Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
Good, how are you?
Doing good. So today we're asking the question, is whitening safe for my teeth?
Mainly moms ask that about their kids.
Yeah.
But anybody that's interested in having their teeth whitened just for their vanity's sake, there's nothing to worry about.
It's a safe procedure.
It's a safe procedure. It's actually a dehydration procedure of the tooth.
Really?
Yeah. So again, this is false information. Don't get your teeth whitened because it's going to kill the nerves and you're going to have sensitivity.
Yeah.
It's not going to kill the nerves. Your nerves are going to die if they're going to die because of cavities or trauma, previous trauma.
Whitening isn't going to do it.
You might push it over the edge only because you're really in bad shape to begin with, but that's what the assessments are for.
Right.
But if you're happy and healthy and there aren't any issues and you want to whiten your teeth, there are two types of peroxide. It's a nitrogen,
okay,
which is called carbamamide peroxides, and hydrogen gels. And we use the hydrogen gels, a little bit safer, a little bit less sensitivity, but you can have sensitivity. And how it works is we put the gel over the tooth and let it sit for about 20 minutes under a blue light. And there's been some research, does the blue light help or not? It's not a laser, we just call it a laser. It just helps bubble it up, if you will.
Yep, helps progress it along.
Exactly.
Yeah.
So what it's doing is it's bubbling and drawing out the protein stains
out of the teeth.
So that's the dehydration part. That's why it looks very white initially. And then it dims back down a little bit. And that's why we ask you to use the gels at home to keep up with it. However, it's the rehydration that makes the tooth feel better. So things like, I just had my teeth whitened for 24 hours. It was killing me. Explain to me what killing you means.
Right.
Well, when I just would sit there and I would drink a cup of coffee or my iced tea, I got a little zing. Well, how long did it last? Oh, just a second. Not killing you.
Yeah.
But, drama in the dental practice.
Right.
That you have to tell your dentist how bad it hurt when it did not feel comfortable.
Right.
Let's just say that. Now, there are a small portion of the population that as soon as we put you underneath that and put the light on, you can feel the sensitivity, and they don't like that feeling, so they associate that with pain, and we just discontinue.
Yeah, it's not right for you.
Yeah. There's a pathology study done with extracted teeth that they put in the hydrogen, the carbamamide peroxides. They did sections through that. They were instructed to tell the researching dentists what's wrong with this tooth. Was there any demineralization? Was there any flaw? Anything?
Right.
Nothing. So it's a preference.
Yeah. Now, is it a good thing to drink a lot of water after you get your teeth whitened? Does that actually help rehydrate the teeth?
That's a good question. That's funny. We always say rehydrate your teeth before you come in, but not so much where you have to get up and go to the bathroom. We're trying to do it. So the procedure is you lay in our chair for about 60 to 90 minutes. So usually 2 to 3 applications, 20 minutes, get you set up, 10 minutes here, 10 minutes there. You're there about an hour and a half. If you have to go to the bathroom constantly because you drank so much water, which happens, so that's
not
why
so good.
I'm telling you right now. But just hydrate prior to that, and then the rehydration,
after is going to be a key thing.
No painkillers. You can take Advils and Tylenol if you think it's really sensitive. What we have found is there's no problem with the teeth. It's not hurting your teeth. Patients enjoy whiter and brighter teeth.
Yes.
So that limited sensitivity that they have had or experienced during the procedure or the day after, the benefit outweighs what they went through.
By leaps and bounds.
It's not,
Because in the oral care that you do at your office, it is about oral health, but it goes beyond that. It's about giving people a smile on their face, making them feel happier. Your smile is some of the first thing people see. Is you want to feel comfortable and happy with it.
Yeah, there's a little thing that it's very difficult for someone that smiles at you that cannot make you smile back. In other words, unless you're really having a bad day.
Yeah.
But most of the time, if I'm saying, "Hey, Jackie, how are you?" and I'm smiling, you're smiling back. I'm great. But if I come by and, "Hey, Jack," you're like, "Hi."
Yeah. And you don't want to be a person who has to smile like this.
Yeah.
You want to be able to show your teeth.
Right, exactly.
So teeth whitening is a great option. It's very safe to do. Better to probably get it done by a dentist at the office. Instead of buying that over-the-counter stuff, you may have better results.
That's a good point. So the younger you are, teenagers are better over the counter.
Okay.
When you do the math on it, though, what you pay in office from an experienced professional practice is the same and actually a little less
Wow.
over the entire year.
Than what you would do doing it at home because those white stripes can be expensive.
Yeah, they don't
can
really.
rack up.
Yeah, they don't really stay on
like it was when
Yeah,
you're under
like
when
they
you're
should.
under the light and you're applying it correctly and you're making
Yeah.
sure you're getting the whole tooth and everything else.
Right.
So it's better to go to a dentist. And as you just said, it's cost effective to get your teeth whitened at a dentist, and it's safe.
And we're not going to have a discussion or a negotiation about whitening or not whitening with my patient. Hey, doc, can I try the crest strips? Yeah, give them a shot. Have you tried them before? No, I haven't. I'm like, okay, this is what you experience. You're going to pay about 60, maybe $65.
Right.
And you're going to put the little thing on. It's not going to stay on real well. And you may not do it anymore. And you got $65 on your
Stuff.
shelf.
Yeah.
So, we have all different types of whitening plans that
And I
meet
know,
your needs.
and me personally, I would rather go into your office for an hour and a half than have to do it every single night at home to keep
Right.
up with it.
Right.
I know I've used them in the past, and they're good sometimes for a day or two, and then it's like you got to use it again to get that whiteness back.
So is it fair to say that, and I don't want to be chauvinistic, but most women would afford $150 every 3 months for their hair?
Oh, more
How
than.
about their nails?
I would venture to
How
bet a lot
How
more.
about the pedicures?
A lot more.
How about the
Yeah.
makeup that
Yeah.
you used
Or
or a woman would
absolutely.
use? So what we're really talking about is far less of maintenance with keeping your teeth white and your smile youthful
Right.
compared to what we're already doing in our lives with going to the gym and getting our Starbucks. So
Yeah.
I'm not trying to compare apples and
Right.
oranges, but that really is what it comes down to. So what are you
Yeah.
trying to accomplish with your smile?
Absolutely. It's a cost-effective option for a cosmetic thing that makes you feel good, makes you look good,
Yeah.
and just helps you have a wonderful, bright smile, makes you smile more often.
Like, who doesn't feel good when someone says, wow, your smile is beautiful?
Yeah, it's the best.
So,
Nothing's better.
Right.
So if you are looking for a whiter smile, call Dr. Bilski's offices today at 216-524-4410 or visit them online at bilskidds.com to schedule an appointment, get your teeth whitened, schedule a consultation as well if you are not sure if you want to get them whitened, and they can answer all of your questions for you. Thank you so much, Dr. Bilski, for talking to us about this today.
pleasure. Thank you.